Hello, everyone. I'm Monica McLemore, and welcome back. I hope you had a good lunch or snack or whatever meal you had, because we're at our 8th session. I'm so excited. For those who are just joining us, the speakers on this panel will discuss their efforts at the state and local levels to address maternal health through a framework of reproductive justice. And I am excited to hear from these individuals. So without further ado, our first speaker is Aja Nedhari, who is a licensed certified professional midwife and family counselor. She founded and is the executive director of the Washington, D.C. community-based organization Mamatoto Village, and I have the distinct pleasure of serving on her PhD dissertation committee. So with that, I look forward to hearing from her. Aja, are you ready?
Yes, I am. Thank you.
Awesome.
All right. And can everyone see my screen? I hope you can. So thank you, Monica, for that introduction. My name is Aja Nedhari. I am the co-founding executive director of Mamatoto Village. I am also a certified professional midwife practicing in the district, as well as a trained family therapist. So we're going to talk a little bit about the work that Mamatoto currently does, some of the successes around our work, and what our future state looks like as we continue to do this work in the DMV and throughout the region. So Mamatoto was started as an idea while I was in undergrad and was brought to life with my co-founder, Cassetta Pringle, who leads our lactation program in 2012. It is this amazing space of rich culture and innovation that truly represents the principles of Ujima, which is collective work and responsibility. Mamatoto offers comprehensive perinatal support in terms of both clinical and non-clinical services and home visiting that bridges the gap for communities in the district and PG County existing on the margins, which for us has been primarily Black women and birthing people. Our work is relationship-based. It is reproductive justice-centered, meaning that we support birthing people in their right to have children, to not have children, and to parent those children in communities of safety and dignity. Our work also exemplifies a cultural overlay, which I'm going to talk a little bit more about, that's reflected in our organizational values and how we embody our work. So how we show up to care is truly an intentional decision. Our organization embodies our spouse values reflected in the mnemonic I Care Sis, which goes beyond lip service and towards this ontological framework reflected in Mickey Kendall's Hood Feminism. It's a framework where we promote collective care to dismantle the ineffective systems of support for Black mamas and families. It is a framework that helps us to acknowledge that the methods and compensatory behaviors that Black birthing people use for survival in a system of racism and white supremacy deserve understanding, curiosity, and grace, not judgment or repackaged respectability narratives to appease those who say I support Black women, except only in certain cases or only certain Black women. I Care Sis for Mamatoto includes investment and care for all Black women, birthing people, and gender identities. So our work encompasses these two really distinct areas. One is service and one is social investment. Our Mothers Rising program is our own homegrown model of home visitation. We utilize evidence-based tools to deliver comprehensive perinatal support in a team-based approach until 3 months postpartum. This program is largely funded through our contracts with Medicaid managed care in the district, offering a source of stable revenue for this program and allowing us really to innovate in a way that we may not be able to with more restricted access to funds. In this model, all home visiting services, including labor support, lactation, mental health, in-home postpartum care, are all covered benefits. Our contracts are both fee for service as well as capitated. And this year, moving into 2022, we are engaging in more value-based contracts with the payers. So data from 2020 is what you're seeing here on the screen right now. Just like all the other programs across the nation, we had to pivot during COVID into a completely virtual space, which definitely shifted the way in which our care was delivered. However, despite that shift, and despite the environment we were forced to navigate, we were able to maintain a 0% maternal mortality rate, which we have maintained since we started the program. We had a 91% full-term delivery rate, a 90% breastfeeding initiation, and 80% of our clients gave birth to a baby of healthy birth weight. We also delivered 5,000 diapers, more than 50 emergency food bags, and engaged in more than 3,765 telehealth visits while maintaining an 84% participation rate for our clients in the program. Our work also involves training and this cultivation of social capital, right? We believe that wealth is already in the community and all we're doing is tapping that wealth and being a convener for people to have a space for self-determination. Our perinatal health worker training program is a rigorous training of over 200 hours that uses a community health worker framework to really focus intently and in depth on the physiologic understandings of the perinatal period, while also emphasizing the history of maternal child health practices, centers of justice, both reproductive, social, and birth justice, and the psychosocial factors, policies, and systemic racism that truly impacts reproduction, pregnancy, and parenting in our priority communities. So where are we headed as an organization? Our future is one in which we are birthing a movement of collective care. And what we mean by that is that we are expanding to moving away from, and we've continued in this space, right? We believe that equity is not enough, that justice is what we need. And through that, we hope to stabilize our presence east of the river. We purchased a new space in the heart of Ward 7, which will anchor us in that community for the long term. It would allow us to expand our services and programs to include a full spectrum clinic, midwifery, and perinatal health worker training, more client meeting rooms, a milk depot, a lactation clinic, and mental health services. Supporting methods of historical and social sovereignty. The crisis of maternal mortality in Black families is one that is rooted in historical lineages of oppression, suppression, and community inequity. Our policies and advocacy initiatives, which we are fostering within our community, require a reckoning with the legacy of medical racism and its symbiosis with the manifestations of economic and gender justice. We are shifting the dynamics of community engagement towards community ownership. Mamatoto has always been a conduit that resources and amplifies the voices of Black women and their families to be witnessed, funded, elevated as subject matter experts of the lived experience at the intersection of multiple oppression identities and the change agents who identify and evaluate the implementation of justice-centered community solutions. And lastly, we are scaling iteratively social change processes. We have acknowledged, lived, and witnessed the tides of oppressive systems that have evolved to maintain the status quo of adverse health outcomes across the personal and generational lifespan of Black families. As a method of accelerating this change, Mamatoto commits to documenting, sharing, and replicating community-based social change initiatives amongst a national network of regional partners to leverage present-day interest and action towards health justice. For us in action, this looks like a Village Keeper Council of community voices, justice-based collective impact partnerships, moving beyond the insular practice and predatory practice of MOUs, networks of coalitions that are fueled with the knowledge of Village Keepers, a perinatal health corps, and dynamic regional and national partnerships. So people often ask us, like, what's the difference in our work? And one of the greatest differentiators of Mamatoto Village's model is that the women who are served are the women who are served. And I often say that because what that means for us is that our staff 100% reflects the communities that we serve, and the clients in our service are thought partners in innovation, strength-based solutions, and strategic action. And this social and cultural proximity has been the driving factor in our success. Our work is multi-generational. It's the framework that we choose to operate from. As a trained marriage and family therapist, I believe that the individual is best understood through the family and environments which nurture them. Our three generations approach is holistic in the way in which we enhance and think about the enhancement of well-being and social wealth of not just the mother-baby dyad, which is often reflected in two-generation approaches, but how we move the entire family towards a structure of wellness. The three generations approach is an upstream solution that recognizes that the intergenerational transmission of health, well-being, and social status. It emphasizes the need to look back to create stability for the birthing person's support system, to facilitate a move for the entire family towards self-determination. Our organization has been adaptable and nimble. We have good financial stewardship, and we work consciously to understand that we must be doing, embodying, and living in the work that we are creating. That our commitment to justice has to be threaded through the structures, policies, practice, and actions of the leadership of the organization. So as I close, I would be remiss to not acknowledge the investment of the Black women who currently work at Mamatoto Village, who lead with me at Mamatoto Village, and those who have been a part of our village in the past. Every person in some way has contributed to our village being what it is today. Thank you.